Hello again. Today we are going to talk about cirrhosis and ascites. Cirrhosis means necrosis, progressive fibrosis, and regeneration in the liver. That's not an infrequent condition, and according to the data from United States, it is affecting at least 1% of the population. In the United States, there have been some studies performed on the people who died as the result of plane crash. These people are going to autopsy because of legal reasons, and then they found 1% of cirrhosis, and these patients mostly have been asymptomatic. That's a pity because in most of the time we diagnose liver diseases in late stages because symptoms are not present. And the early stages of liver diseases are diagnosed in most of the time incidentally. Incidentally means that we are not specifically looking for this disease, but in any type of physical examination, imaging, or laboratory examination, we find that there are some abnormalities referable to liver. Then when we search more, we find some liver disorder. Actually, this is a good thing for the patient. Otherwise, we can diagnose it when the symptoms appear and the disease may be in advanced stage. What are the etiologies for liver diseases? In our country, the leading cause for liver cirrhosis is hepatitis B infection. Incidence is decreasing, but it is still present. But thanks to hepatitis B vaccination and effective treatment, I think in the next decades, hepatitis will be a less problem in Turkey as well. However, at the present time, at least 3% of Turkish people are carrying this virus in their blood. This rate is less than 1 in 1,000 in Western countries. So hepatitis B is not a problem in the natives of Western countries, but you see that there are too many migrants in these countries, and because of this, these countries are dealing with this condition as well. It is not present in their native population, but it is coming with migrant population. Hepatitis C have been an important problem until 20 years ago, but in the last 10 to 20 years, we are having a very effective treatment as well as very effective means to control the transmission. Then hepatitis C is becoming less problem. Cryptogenic means that we do not know the reason for liver disease. It is estimated to be 10%, but now we are increasingly recognizing that for most of these cases, the culprit is non-alcoholic steatohepatitis. Non-alcoholic steatohepatitis means that there is a damage in liver, which is similar to alcoholic damage, but there is no intake of alcohol. It is present in mostly obese and diabetic patients. And now non-alcoholic steatohepatitis is the leading cause for cirrhosis in Western countries, and it is becoming in this country as well. There are, of course, alcoholic liver damage is also an important problem, but in Islamic countries, alcoholic cirrhosis is not as frequent as it is in Western countries. There is a type of cirrhosis which is called as biliary cirrhosis. It's characterized by the poor excretion of bile from the liver. These diseases are relatively rare: primary biliary cirrhosis, sclerosing cholangitis, and this disease will be lectured to you in pediatric lectures. progressive familial intrahepatic cholestasis, which is called as PFIC. At this stage, if you know these by name and if you know that these are biliary cirrhosis, then that will be suffice for you. And there are some rare causes like copper and iron deposition in the liver. In large amounts, these heavy metals are toxic to the liver. And Wilson's disease, there is poor excretion of copper from the liver. And in hemochromatosis, there is hyperabsorption of iron from intestine. These are genetic diseases, and the genetic predisposition to Wilson's disease is more common in Celtic population, which is present in West Europe. But in this country, Wilson's disease, I'm sorry, this is true for hemochromatosis. For the hemochromatosis, the mutation is more common in Celtic population in Western countries, but this mutation is not common in Turkey for hemochromatosis. Then this is a less problem in this country. Wilson's disease is also a genetic disease. And the problem is that the diagnosis of Wilson's disease is very difficult. So in any patient with unexplainable liver disease, there is no definitive etiology, we should look for Wilson's disease, because if Wilson's disease is treated earlier, then the outcome is perfect. But if Wilson's disease if we fail to diagnose this disease, it will cause damage in many organs, especially in neurologic system, because in this condition, the copper is accumulated not only in liver, but many parts of the body, including neurologic system. And some of these patients actually are going to neurologic clinics because the neurologic symptoms may predominate over liver disease. More detail will be lectured to you in the 4th grade. If we come to the pathogenesis of liver disease, immunological damage is present in hepatitis B, C, and delta hepatitis. Delta hepatitis is a superimposed hepatitis in hepatitis B. So there is an already existing hepatitis B infection. And in this infection, there is a super infection, delta, because delta cannot produce disease without the presence of hepatitis B. Then the superimposition of the virus would make the course of the disease worse. It is also infrequent, and incidence is decreasing, but still present in this country. It is also present in sub-Saharan Africa, some parts of Greece, and South America. In most of the other countries, it is not present. In NASH and as well as ASH, alcoholic liver damage and non-alcoholic liver damage, non-alcoholic steatohepatitis, there is a metabolic damage. In biliary cirrhosis, there is damage due to accumulated bile content. We talked about Wilson's and hemochromatosis. And all these diseases are resulting with progressive fibrosis, as we are going to see in the following cartoon. Progressive fibrosis is causing derangement of liver function. Another dreadful complication of liver cirrhosis is the development of hepatocellular carcinoma. Hepatocellular carcinoma is mostly a disease of patients with liver cirrhosis. And if it is small, there will be no symptom. And in order to diagnose it in early stages, we are surveying, we are screening all the patients with cirrhosis for the development of hepatocellular carcinoma intermittently, generally 3 to 6 months. So we examine with ultrasonography to find the development of this disease in early stages, because it is asymptomatic until it reaches 9 centimeters. And if it is in this diameter, the average survival is less than 3 months. So we should find it before it gives rise to symptoms. Now, in this cartoon, you would see the overall feature of cirrhosis. And as I told you in the introductory lectures, liver is receiving blood from two systems. One is portal vein. Portal vein is carrying blood from intestine into the liver, and it is containing all the substrates, the raw material, to be converted to the useful products for the body. For example, hormone carrying proteins, some compounds like albumin, which is worthwhile for the body. And at the same time, the fatty acids coming to liver are converted some products like low density lipoprotein, which is secreted into blood to meet the challenge of fasting in muscles. It's also producing some substances in glycoprotein nature. So liver is working like a factory. And as we are going to see, liver is also producing our body temperature in 37 Celsius degree. If liver does not work, the life is not possible. And it is a single organ, not like kidneys and lungs. Hepatic artery is providing oxygen necessary for these immense metabolic processes happening in the liver. And liver has a unique property that the portal vein is here. These are called the sinusoids. The terminal parts of portal vein are called the sinusoids. And in sinusoids, you see there are some spaces. These are called as fenestrate. Fenestrates are allowing the substrates to come to contact with hepatocytes. These are very large spaces in comparison to the intercellular spaces in other vessels. It is 40 times larger because it should provide excess of the substrates into the hepatocytes that they will go into some metabolic processes. And at the same time, sinusoids are containing blood mixed with hepatic artery as well. So the final branches of hepatic artery, which is called as arterioles, are coming into contact with portal vein. And so in the sinusoids, there is arterial as well as portal vein blood. Portal vein is carrying the substrates, and hepatic artery is producing oxygen necessary for these processes. If there is an damage to the liver, so an inciting agent like alcohol or toxic bile acids, in toxic amounts, bile acids, or some immunological attack to the liver, then these cells are activated. Actually, in liver, most of the cells are hepatocytes, but besides hepatocytes, there are other cells as well. For example, these are bile duct epithelial cells, a second cell line, and third, endothelial cells, and fourth, stellate cells. So there are some different types of cells in the liver. The stellate cells are in the distal space. The distal space is between the endothelial cell of the sinusoid and hepatocyte. And in physiological state, these cells are dormant, so they are not doing anything. At least we believe like this. But if a damage happens to liver in any way, that may be alcohol, immunologic, or any other type of insight into the liver, then these stellate cells will be activated. And when they are activated, they secrete collagen. This collagen is accumulating in this space. And accumulation of this fibrotic tissue actually is intended to limit the damage. So the body is trying to accumulate collagen and to keep the damage in a limited space. So it's a good intention. But if the disease is diffuse, and in most of the time this is like this fibrosis will be counterproductive for the body. Why? Because it is blocking this fenestrate, and it prevents liver functions. And at the same time, it is blocking the perfusion of the liver with oxygen, and hypoxic damage will be added as well. So in the long run, even if it is intended to do something good to the patient, it would be counterproductive. Because of this, we are trying to prevent the damage, to decrease the accumulation of this collagen tissue in the distal space, which is the space between endothelial cells and hepatocytes. And you see here the stellate cell in physiological state, no fibrosis and presence of fibrosis. But the fortuitous aspect is that if it is not very extensive, and if the damage is stopped, so for example, the patient's condition is like this, and we stop the damage, for example, we treat hepatitis B, we treat hepatitis C, we tell the patient quit alcohol, or decreasing body weight, control of diabetes mellitus, and all these measures, these would result with the resolution of this fibrotic tissue. So fibrotic tissue, the accumulation of collagen, is a dynamic process in both ways. When the damage is stopped, then these fibrotic tissue would disappear. Until what time? Until the microangioarchitecture of the liver is impaired. If microangioarchitecture of the liver is impaired, then we believe that the damage is irreversible. So all our measures will be effective until this change happens. And because of this, we are trying to catch the disease in early stage and to treat it and to prevent the change in microangioarchitecture. And if we fail to do this, the result will be this: the regeneration nodules and extensive fibrosis. But even in such a patient, so you see there's a significant damage to the liver morphologically, but believe me that this patient could be totally asymptomatic. A patient like this could have a very effective supporting activity. Even he or she can play football, any type of sport, no symptom. It shows us that the liver has an immense compensatory mechanism. So until there is a very, very significant damage, the liver would function to allow the survival of the subject in its usual way. I produced this cartoon to show you the damage related to immunology, and any type of virus, hepatotropic virus. Hepatotropic means that the virus is finding its way to hepatocyte. For example, hepatitis B. When the body is exposed to hepatitis B, the adaptive immune system is working to get rid of the virus. And because virus is residing in hepatocyte, this immunological system is trying to kill the virus in hepatocyte. But it is very difficult in this process to tell apart hepatocyte and virus. And because of this, while killing the virus, this immunological activity would kill hepatocyte as well. And this is producing the damage. Actually, there is a type of hepatitis which is called as autoimmune hepatitis. Autoimmune hepatitis is a cause for liver cirrhosis as well. In autoimmune hepatitis, we do not know why the body's immunological system are damaging its own cells. But this is a not infrequent disease in females, and autoimmune hepatitis is very dangerous if it is not treated. Before effective treatment was available for this disease, most of the patients have been dying because of autoimmune hepatitis. Now we can treat them and they will have a very good survival. As I told you before, the body's protective systems are working very effectively against autoimmunity, but we do not know in which way the immunological system are becoming stray and becoming uncontrolled and damaging its own cells. And this is out of our scope, and I think it will be covered in your immunologic lectures. But you should know that autoimmune diseases sometimes are more dangerous than microorganism related diseases. I produced this cartoon to describe you the damage in fatty liver disease. In fatty liver disease, the free fatty acids coming to hepatocyte is out of its capacity to metabolize it. So if the person is taking too much fat, or there's an obesity that is producing free fatty acids to liver continuously, then these free fatty acids will be out of control. In a physiological system, free fatty acids are metabolized in the liver, in hepatocytes, and the body temperature is produced. But if it is too much, then it should be accumulated as the form of triglyceride. And in a physiological state, this is less than 5% of the liver volume. But in fatty liver disease, it may reach up to 90%. And then liver damage is happening. We are going to talk about in detail in the lecture of fatty liver disease. In incidental disease, I told you that we diagnose it with an abnormality of liver function or abnormality in physical examination. Actually, even in early stages, there may be some non-specific symptoms like malaise, intolerance to activity, dyspepsia, but it is very difficult to ascribe these symptoms to liver disease. But in any way, if there are these symptoms in somebody and we cannot explain it with other condition, then we should look for liver disease. If it is in late stages, so the complications happens, ascites is a complication of liver disease, presence of varices, and mental confusion, which is called as hepatic encephalopathy. So these are not difficult to diagnose, but unfortunately, these findings are indicating that the liver is in a very late stage, and the only mean to treat for this to this patient is to provide liver transplantation. And as I told you, the dreadful complication, hepatocellular carcinoma, and I told you that in order to diagnose this in early stages, we should screen the patients. But unfortunately, 40% of the patients with hepatocellular carcinoma, in 40%, the cirrhosis and hepatocellular carcinoma are diagnosed at the same time. So the patient has been asymptomatic without findings until the development of hepatocellular carcinoma. This is interesting because the liver is damaged, fibrosis is happening, it is progressing, cirrhosis is happening, it is becoming advanced, then hepatocellular carcinoma develops, then it reaches 9 centimeter and we diagnose at this stage. So from the beginning, this process will be up to 20 years, but in 20 years, we cannot diagnose the disease because the symptoms are either not present or non-specific. These are the peripheral signs of cirrhosis. So but in an asymptomatic cirrhotic patients, none of these will be present. These are the findings which indicates that the cirrhosis is in late stage. For example, splenomegaly, dilated abdominal veins, presence of fluid in peritoneal space, loss of sexual hair, spider nevi, the arteriolar dilation, gynecomastia, jaundice, icterus, testicular atrophy, edema. These are all findings of decompensated cirrhosis. We are skipping laboratory findings and imaging. What is the prognosis in compensated cirrhosis? If we are talking about compensated cirrhosis, it means that cirrhosis is there, but there is no clinical complication. What are the clinical complications? Ascites, variceal bleeding, and hepatic encephalopathy. If these are not present, we call this as compensated cirrhosis. So the liver is compensating for the damage and the patient is surviving as usual. In compensated cirrhosis, in every year, if it is left untreated, 5% will develop decompensation. And in decompensated cirrhosis, there is a mortality rate of 20% per year. Because of this, we are considering these patients for liver transplantation. And the dreadful complication, hepatocellular carcinoma, is developing between 1 to 5% of the subjects with cirrhosis per year. These are the main complications of cirrhosis. Again, ascites, esophageal and gastric varices, hepatic encephalopathy, hepatorenal syndrome. Hepatorenal syndrome is a specific type of renal condition associated to decompensated cirrhosis, hepatopulmonary syndrome, portopulmonary syndrome, and a special type of heart disease, which is called as cirrhotic cardiomyopathy. Now we are focusing on ascites. Ascites means there is an increased fluid between parietal and visceral peritoneum. In introductory lectures, I told you that in peritoneum, there is a very small fluid to prevent the friction between the two parts of peritoneum, parietal and visceral. But in advanced cirrhosis, there is an accumulation of fluid in this space. Actually, cirrhosis is not the only disease with ascites. It may be present due to peritoneal involvement from microbiological agents like tuberculosis, as well as from malignancy. This is called as malignant ascites or peritonitis carcinomatosa. Peritonitis carcinomatosa, involvement of the peritoneum with malignant cells are producing a picture which is called as malignant ascites. The symptoms of ascites are abdominal swelling, dyspepsia, anorexia, and weight loss. And in introductory lectures, I told you that simply a swelling of the abdomen may be present in irritable bowel syndrome due to meteorism, and it may also be present in any type of intra-abdominal or extra-abdominal masses. It is diagnosed with physical examination, but ultrasonography is more sensitive. In advanced stage, it is apparent even with inspection, but in early stages, in very small amount, it could only be diagnosed with imaging methods. We differentiate two types of ascites, which the first is related to peritoneal disease, like tuberculous peritonitis, or primary or secondary involvement of the peritoneum with malignancy. The primary involvement is called mesothelioma. Mesothelioma is a malignancy of peritoneum itself. The second type is ascites due to diseases outside of peritoneum, like cirrhosis, but it may happen in heart failure, in some kidney problems, or in some immunological diseases like systemic lupus, and even some endocrinological disorders like hypothyroidism. This is out of your scope. But yes, we skip this. In cirrhosis, the presence of ascites, as I repeatedly saying, is denoting that the disease is in advanced stage. What are the harmful effects of ascites? Why are we trying to treat ascites? Because it is causing a disfigured body. It is impairing nutrition. It increases the risk of variceal bleeding. It increases the risk of renal failure. And the last but not the least, this fluid will be infected with enteric pathogens, enteric bacteria. When the microbiota microbiota components, the bacteria are in the colon, these are not harmful. But in liver cirrhosis, there is a leakage. There is an increased permeability from colon to peritoneum. And if there is fluid, it will provide a very convenient medium for this bacteria to proliferate. Then a condition which is called a spontaneous bacterial peritonitis may happen. The fatality rate is up to 50%. And if it develops, we are going to consider immediately the patient for liver transplantation after due treatment was given to spontaneous bacterial peritonitis. That will be all for cirrhosis and ascites. And now we are going to start to discuss the individual liver diseases like hepatitis B, C, non-alcoholic steatohepatitis. Thank you very much.